Hi, my name is Bridget Early. Today is January 26th, 2021, and I will be presenting on concussion post-concussion syndrome. A typical patient presentation: a 16-year-old male presents with worsening headaches, nausea, vomiting, confusion, and dizziness. He mentions that he and a football teammate had a hard head-on collision earlier this morning. The patient also says he is tired and his vision is blurry. He noted that his memory was foggy immediately after the hard hit and has trouble remembering what happened before the head collision occurred. Definition of concussion. A concussion can be defined or classified as a type of mild traumatic brain injury, also known as a TBI, that is typically caused by a bump, jolt, or blow to the head. The sudden impact of the injury causes the brain to move back and forth or shake inside the skull. Concussions cause damage at the cellular level and chemical changes within the brain. Etiology or causes of concussions can range from violent blows to the head or neck, rapid acceleration or deceleration of the head, motor vehicle accidents, sports injury incidents, hard falls, or any history of previous concussion or concussion prior to the event. All of these actions can cause the brain to shake inside the skull, which results in a concussion. Some background on concussion and post-concussion syndrome includes there is an estimated 1.6 and 3.8 million sports-related concussions per year. The probability for an athlete involved in contact sports to get a concussion is 20% per season. Contact sports include football, hockey, rugby, boxing, and other sports that include physical contact. 56,800 deaths were traumatic brain injury related in 2014. Concussions and post-concussion syndrome fall under the traumatic brain injury category. Retired NFL players display early onset of Alzheimer's, which is also linked to recent diagnoses of CTE, or chronic traumatic encephalopathy, which is when the brain degenerates as a result of multiple head injuries. This is also linked to post-concussion syndrome and concussions. Older people and women are more likely to develop post-concussion symptoms. The reasoning behind this, however, is unknown. Risk factors for concussion and post-concussion syndrome include having a history of prior concussion or concussions is a risk factor. This is because having multiple concussions can lead to long-term effects involving the brain, like concentration and memory issues or repeated headaches. Participating in contact sports puts individuals at risk. Head injuries and concussions are common in contact sports like football, soccer, and hockey, among others. Collisions with teammates or any other players can happen, resulting in the possibility of blows to the head or jolts. Women's soccer in particular is at high risk because of its contact, as well as players frequently using their heads to pass the ball when playing. Younger athletes are also included in this category. This could be because they are still learning the sports they are participating in, which can be the contact sports. Females are also at higher risk, however, it is not known why. Accidents involving significant head trauma, such as car or motorcycle crash, puts people at risk. Falling, which is common amongst the elderly population. Concussions are common for people 65 and up if they take a fall, leading to them hitting their head on a hard surface or object. And lastly, being a soldier in combat is also a risk factor, because there is a greater likelihood of getting injured in a violent setting, such as a battlefield. Pathophysiology of concussions and post-concussion syndrome. Clinical symptoms result from neuronal dysfunction as opposed to structural abnormalities. Disruption of neuronal homeostatic balances can be caused by mechanical insult, which initiates a complex cascade of metabolic events. Mitochondrial dysfunction seems to be a main biochemical explanation for most post-concussive signs and symptoms. It can result in neuropathological changes. Axonal neurofilament within the brain causes organization disruption, which explains the symptoms of confusion and impaired thinking. Release of excitatory neurotransmitters such as glutamine and acetylcholine generation of free radicals can lead to secondary injury post-concussion syndrome. Pathophysiology continued. Concussed cells enter a peculiar state of vulnerability, which is second impact syndrome or post-concussion syndrome. If a second concussion is sustained while they are in this state, they may be irreversibly damaged. This condition of concussion-induced brain vulnerability, higher fractional anastrophe, lower diffusivity in corpus callosum, which is brain swelling, brief tachycardia or temporary blood pressure decrease. Brief tachycardia is a raise in the heartbeat and the blood pressure decreases. And here this image displays brain picture images of prior concussion and post-concussion. On the left, this is what a regular brain would look like, as opposed to the right, which would be after a concussion. The areas where working memory, number processing, motor planning, and other mental processes are negatively impacted, brain cells become misshapen or altered, which impact these cognitive processes. And you can see here with the lit up areas within the brains. Some significant symptoms of concussions are displaying confusion, experiencing nausea or vomiting, headaches, dizziness, or amnesia, or forgetting events that took place before the trauma. Some later symptoms that can be displayed are fatigue, depression, or insomnia, and these symptoms can lead to post-concussion symptoms, which are closely related. To diagnose a concussion, a medical professional must confirm this presence of a cluster or combination of signs and symptoms after one experiences a blow, hit, or jolt to the head or body. For athletes, there is typically a scale that athletic trainers, doctors, or other medical personnel use to diagnose a concussion. They rate the symptoms that athletes display on a scale. Neuroimaging machines like CT scan or MRI scan are helpful in ruling out any other more serious possible head injuries like brain swelling or hemorrhages that would require surgery. Cognitive and imaging tests are tools that are used to analyze memory, concentration, recollection of events, and information, like the Glasgow Coma Scale, which scores an individual's response to showing concussive symptoms. For treating a concussion, observations by a doctor, family member, or friend for 24 hours after a concussion to watch for a progression of symptoms to see if they worsen. Resting mentally and physically allows for the brain to have a better recovery. Avoiding bright light, such as well-lit rooms or on a very sunny day. Limiting screen time light to avoid worsening symptoms such as electronics like television or computers or phones. Avoiding thinking and concentration activity. This reduces any added stress on the brain like schoolwork or any work-related activities. No physical activity. This prevents another head injury from happening or again worsening any symptoms. Exercising during a concussion will worsen these symptoms and cause more damage to the brain and will not allow it to heal correctly. Gradually returning to everyday activities such as sports, work, or schoolwork is recommended to heal a concussion properly. Pain relief can be taken such as Tylenol or acetaminophen. This helps treat the pain of any headache or other symptoms that one may experience when having a concussion. Some post-concussive syndrome. So we have that a post-concussion syndrome is a continuation of a mix of symptoms weeks after a concussion has occurred. Statistics show that 30 to 80% of patients with mild to moderate head injuries can experience post-concussion syndrome symptoms. The severity or how serious a traumatic brain injury has no correlation of getting post-concussion syndrome. Some risk factors for post-concussion syndrome are the female sex and elderly people for unknown reasons again. History of multiple concussions yet again are at risk for displaying prolonged symptoms because the amount of trauma to the brain that has occurred in the past. Symptoms are similar to concussions, including headache, dizziness, irritability, or the ability to get agitated easily. Fatigue, insomnia, also known as not being able to fall asleep right away or just having any sleep difficulty. Concentration and memory difficulty, noise sensitivity, specifically loud noises such as sporting events or concerts. The pathophysiology behind post-concussion syndrome is not certain. For diagnosing post-concussion syndrome, CTs or MRIs and other neuroimaging machines are optional for diagnosis. For treating post-concussion syndrome, physical and cognitive rest are recommended, limiting activities that trigger symptoms and then gradually returning to activities, just like concussions. Headache management medications such as prescriptions from a doctor or over-the-counter medications like Tylenol, Advil, or acetaminophen too can help treat post-concussive symptoms. And here are my references. Let me know if any of you guys have any questions. Thank you so much.